Okay, so as you guys know, we have a retreat going on this weekend. Chelsea is one of the moderators. She has been literally going through hell, which is, I'm just so happy she's finally on the table. We've been like out country dancing and acting a fool, so now it's time to get down to business. Yep. So she's post-operative. I'm on the right arm, right?
Yeah. Oh yeah.
I always forget.
That's the one.
Okay, so just can you tell them what you had done and what you've been going through?
I fractured my wrist in 4 places. The radius was fractured into 3 little pieces.
It's too loud.
And the ulna was fractured. A piece of it just broke off, and so I had to have a bone graft in it actually, and then pins were put in, and then screws and a plate, and this one had to be screwed together too.
How often do you think that happens to massage therapists? I mean, I know wrist and we get, carpal tunnel and like all that kind of stuff, but this is not a normal injury. Yeah.
It's not normal.
And it's also a major injury. I mean, we're talking shattered plates, pins. How post-operative?
The reconstructive surgery alone was July 11th.
Okay, so just so y'all know, I say it all the time, but y'all don't watch everything apparently. I don't know why you're not watching me all the time. But 12 weeks post-operative, okay? You can go all around the incision site, but not on the incision site for 12 weeks. It's a safety precaution. I've done that my whole career, okay? So we're good on the 12 weeks. So what I want to show you is, we all talk about cellulite, and we've learned the terms beyond bound. Any surgery site, including my hip replacement, this is going to be beyond bound. So in our book, The Cellulite Myth, which by the way is #1 on the bestseller list, if you cannot pinch over an inch, meaning like if you grab it and the tissue is bound, anything over an inch, that's considered beyond bound fascia, okay? So obviously Chelsea doesn't have cellulite in her arm, but what I want to try to transition the whole group to understanding is that the types of fascia determine the types of cellulite, and they're all the same thing. So we need to stop actually calling it cellulite and just call it what it is, which this is beyond bound.
Well, it was in a cast for 2 months.
Yeah, totally immobile. So Bart and I did this amazing, we accidentally ordered some books off Amazon, but one of them shows inside the body where surgically you can see the skin lifting up like this, and you can see almost like mozzarella cheese on a pizza, right? Have y'all seen that video? If not, we can put it in the comments.
It's on YouTube.
Yeah, it's on YouTube. What's it called? Do you know?
It's a recent video about fascia. It says something about...
We'll put a link in the comments on this thread. But what I'm going to do on her, you can do this anywhere on your body. If you're sensitive, I would start with this. I show in the fibromyalgia video, like slap down techniques. I'm actually going to use the FasciaBlaster on her. Do we have a face one down here? I know the face is not out yet, but over time, you guys, since you guys are just kicking it with me as far as like the knowledge, there's like a series of things that you can do. We call it disarming the tissue, okay? So she's not nervy sensitive. If she were nervy sensitive, right, that doesn't feel like pins and needles. If this were to feel like pins and needles, I would start by doing a slap down technique, okay? And Kathleen is fixing a migraine right now, but she could explain this, that neurologically you're basically tricking the brain and desensitizing those nerve endings. So anyone that's having, not like a deep sciatic type pain, but if you're fascia blasting and you're feeling firecrackers, this is a really good technique to disarm it. Or if you're that swollen, like where are my lupus people? Are they chiming in? Lupus, arthritis, fibros, Hashimoto's, slap down technique, okay? Then you would move on to the technique that I'm going to show in this video. So I'm using a paper towel. You could use a nice TheraBand, anything that opens a can. You just want to be able to get a good grip on the skin, okay? You felt it, right?
I did.
Okay, so when you're doing fascia pulls, you start big and then you get smaller and smaller and smaller, okay? So, and I don't mean on the body. I mean start with a big chunk of meat, and the technique is to grab it and pull it away from the bone. Okay, so a lot of people try to do it and they just come over and they start pinching, and you're like, no, that's not the fascia pull technique. You're literally, I'm grabbing as much of her muscles in her forearm as I can get, and you feel that, right?
Yeah.
It's a real steady squeeze up. Okay, so if it were a leg, you would do the same thing. Kim, you should show them on your leg because you fascia pull your leg every 5 seconds. Yeah, relax it. So if it were a leg, you would get a bigger piece, pull it away from the bone, any direction. And you'll find like you're looser this way than you are that way.
Yeah.
So then this would be the way you would want to work, okay? So fascia pulls, you kind of brace it with your fingers and then just pull it up gently. And if you're doing it to someone else and you're not a trained professional, tread lightly is what I would say. Like, don't slap your husband's rotator cuff surgery arm on the table and just start pinching the heck out of him. But you can start like this and then communicate with whoever you're working on. Like, Chelsea, what's that on a pain level?
Probably a 6.
Yeah, so she's at a 6 with me barely pulling up. So I might do it like this, where I'm just kind of oscillating. And can you explain what it feels like? Because it does kind of feel like it's pulling away.
It feels like it's pulling away.
So what we're trying to do with Beyond Bound, it's like if this towel were all the way like this. And I was trying to do some work on Chelsea's stomach. I couldn't do it because I would run into this towel. So what I'm trying to do is create space so then I can then go in, and I call it rotor rooting. But like when rotor rooting is what you would do with like the, you know, the nugget where you're actually cleaning everything out. But this is going to take me probably an hour, okay? Because until I can get the towel loose or get this to be beyond bound, it already feels better. Also, by the way, you guys, look, just from the pull, do you see the redness? Like we're getting some blood flow.
So people are asking, what is this for? Why would you do this?
You would do this as a prep for fascia blasting. It's a way to pull the fascia away, pull the skin away, pull the fascia off the bone, pull the fascia through the muscle so that it's nice and loose, and then when the claws go in, you can get deeper.
Should you fascia pull before blasting?
Before blasting.
She's
After
heated.
heating. So if you look outside there, I just stuck Chelsea and Jeanette and everybody else who's laying on the tables in the hot tub for about, we were in there about half an hour. So she's still warm to the touch, okay? So, you know, can you do a fascia pull anytime? Yes. You can be sitting in the car and be like, I'm going to fascia pull my, you know, inner thigh. But if you're going to do a real treatment on yourself or your family members, or you're going to, you know, like go through the whole process. And so the process would be to heat, use any desensitizing thing that we have, which is light fascia blasting, this technique that I'm showing you, the slap down, anything in the fibromyalgia video that's on YouTube. And you can just stick it in the comments when we're done. And then you would fascia blast. And I actually, as the fascia blasters roll out and we have them all, this would be the prep, the face. Then you would go in with the big one, and then you would go back with the nugget, and then you would flush at the end, okay? So we're working on that. We have to, it's a lot, you guys, to get all the products available to the public, but that's my goal, is to have it be a series, okay? So this is all pre-fascia blasting, though. Does that make sense?
Yes.
And then I want to do a live feed when we're done, because I want you guys to see, like, this has no movement. Let's look at the range. So that's about in range right there. We call it R1 in therapy. It's where you get the first amount of resistance, and then this is going to be shitty. Yeah. Hurts, right?
Actually, it doesn't.
Do you just feel stuck?
Yeah.
Okay, so she feels stuck here, and this one has pain, yes?
Yeah.
Where?
Top.
So she feels, actually, it's interesting because this is a stretch of the bottom part of the arm. So anytime you feel pain opposite the stretch, it means it's jammed. Okay? So like if you pull your hip up like this and it just won't go and you feel it in the front, this is a stretch of the back. If you feel it poking in the front, then it's an impingement. So one of the things that as fascia yoga and all that rolls out is I'm going to teach you guys the difference between like what a pinchy, jammed, I'm stuck stretch is versus a real stretch. And you don't ever want to be doing a stretch and feel the opposite of what you're trying to stretch, because it means that your bones need to be pulled apart and there needs to be joint space. Okay? So are they having more questions about the pulls?
Will this help with tendinitis, wrist pain, carpal tunnel?
Yes. So if you had carpal tunnel, you still have to remember that the fascia goes all the way through, okay? We always think of it as, even in massage therapy school, isn't it like front, back, sides, you know, whatever, but really all of this tissue is all the way through. So think of it more of like a casing, and I use that lightly. It's more like strips with webbing, which if you read the book, we show pictures and it makes it a lot easier. But you would want to go all the way around the entire thing. And you don't even, I wouldn't even consider fascia blasting this until I could completely move her skin. And see how right now, like particularly here, that's as far as it goes. Okay, so what we'll show in terms of the after is what it looks like and when it's actually ready to be fascia blasted. Okay, so the pulls are just a higher skill technique that you can use pre fascia blaster. Okay, now you're not going to kill yourself or anything if you go in and fascia blast from the jump. It's just might be more painful. It may take a little bit longer. If you don't heat, it's going to be super tight and harder to make it work. So I'm not saying don't do it. What I'm saying is that if you really want to give yourself the best treatment, this is best practices. Okay?
Someone said it's different than skin rolling.
Yes, because skin rolling is where you're going like this and rolling the skin, which is a totally, completely different feel than straight up and away.
Chelsea's
Okay?
face says so.
Well, tell them the difference because she's a massage therapist. Do they teach rolling in LMT school?
Yeah, well, they taught us a little bit of skin rolling, and I never really found much use for it, but that does a lot more.
I think that the intention of skin rolling is probably to do what fascia pulls do. I just don't think it. I just don't think it does.
You're not
Like
really
even
able to grab very much with the skin rolling versus the skin pulling.
yeah, it's almost like taking the cheese on the top of a pizza and rolling it versus taking the cheese and lifting it. Right?
Mm-hmm.
Can y'all visualize that? I see that, but I see inside the body. So are they going? What?
It's like a suction cup.
It is like this is why things like Vela shape, not cupping, because cupping pulls hard enough that it's actually sucking the blood up. She's not going to have like a cupping type bruise from this. So this is more specific to the fascia versus sucking up skin and blood vessels like cupping. They're just different. I'm not like I personally don't do cupping. I have because I feel like it's maybe an overkill or something that you should alternate with the fascia blaster, and I just prefer the fascia blaster, but I think they have different purposes. It's just like, you know, the gouache people. Like that is actual scraping of the skin to bring blood to the surface. The cupping is sucking up the skin and the fluids, and that's why you get a
Bringing
hickey.
the blood flow to
Bringing the fluid to a very specific area. When I'm doing a fascia pull, that's not what I'm trying to do. So there's use for all of that. I'm just saying specifically for what I'm trying to do to Chelsea, which is to rip into her scar tissue here in just a minute with the nugget. I got to get this beyond bound out of the way, and the fascia pulls are a great way to do that. I'll move the napkin. Can you see?
So you're using a napkin, why?
Just to help me with grip. This just helps me stick to her skin. That's all there is to it. Because if she starts to sweat, then my fingers are going to slide. So this is definitely not done with oil. The last thing you want is to slide. You want them as dry as possible to do fascia pulls. Start trying this. Anybody who's listening to the live feed right now, go try this on your leg. Try it on your ankles. Try it on your calves. Grab an inner thigh.
And if you missed this video, it's saved in the video section so you can watch the recording after we end here.
So now I'm even like pulling down into her hand. But look at the movement I'm getting. That's different than when we started, right?
Yeah.
And I'm barely even doing anything, you guys. How long it's been, maybe an hour. But first of all, I just want to show you the pliability of this tissue when this whole entire arm was a chunk. It's also half the size, right? Okay, so some visual things that you guys can see. If we took a still frame from the first video, like her arm is literally half the size from just being bound and all bound up in inflammation. So this is somebody who just had major reconstructive surgery. Look at this range of motion. Pain-free as well, right?
It doesn't hurt at all.
Do it with her arm down like you had it so we can compare.
Pain-free. And you can physically see, look at her, you couldn't see that vein before. and all the blood is starting to come back. And I was able, look at, I opened every single joint in her face. Like, a lot of times when you have surgery, this joint right here, it'll get jammed. I wish I had a video of that. You can feel the bone wiggling like that inside, but how amazing is that relief? Because when that is stuck in there, it like makes it where texting is almost impossible.
Yeah,
And I did that one with the FasciaBlaster. I did the FasciaBlaster and then I just pulled, okay? Pulled, wiggled, shaped. All of her hand is open. And I mean, this is, for all intents and purposes, it's ready to rehab. It needs to rehab. And I would love to be able to scrape down between the radius and ulnar. But at the end of the day, you can only treat so much in one day. And then you start to swell. And then it feels way worse. So I always go to the point of when it starts to swell, I'm like, okay, it's a wrap. But this is an outstanding result. And she can speak as an LMT, like, what that feels like. And the difference in massage, because, you know, I love LMTs, don't get me wrong. I'm just saying that you can learn these techniques and do more stuff.
Yeah, totally.
She's like an amazing.
How does it feel?
It feels so much freer now.
Did you think that was possible?
I did, kind of, but
Well, look at that range of motion. The supinating and pronating.
yeah, I couldn't supinate very much.
And let me say, she's going to have no strength. Like, you're going to have a hard time pulling it back yourself. Yeah, so if she's pulling it, she's going to be able to do it. But because I just opened it, her muscles are atrophied. They're not going to do it. So that's where the strength comes in. It's just like what we're doing with Jeanette's leg. As soon as we open up her adductor, she needs to fire it. Kim, that's something we get asked all the time on the page. Like, you open something and then you fire it off. And when I say
access my forearms a lot better now.
yeah.
That was way better.
It's 1,000% better. I'm super happy with this. For the first post-operative treatment, that's a 10. That's a 10 on the success scale. I mean, I'd love to do it 5 more times, but Chelsea can treat herself. She's an LMT. She knows how. And then what she can, you see her firing the muscles. She's gonna fire everything off. She's gonna mobilize her own arm. She's gonna go home, and 2 days later, when the swelling's down, she's gonna start FasciaBlasting. And eventually she's going to be nuggeting out her carpal tunnel and rotor-rooting all around the fingers, and that's
getting all up in that.
yeah, all up in it. And she's going to have, I mean, this for her is her career. Number one, she can't moderate without her fingers. She needs to be able to hit that delete
Her moderating career, and then her other career too. You know, the massage one.
But she is a massage therapist, and this is something that could be career-ending for her. And FasciaBlasting is a big part of her practice, but she can FasciaBlast now. You can hold a FasciaBlaster right now and FasciaBlast.
Yeah.
So all you LMTs out there, save your wrists. And just
You don't fall on it.
yeah, don't fall on it. But yeah, I'm super stoked with that, and the fact that it's pain-free. Because it's one thing to
fun.
stretch
I'm
it,
just going
but
into my
that's a
hand
functional
here.
range right there.
That's basically what I need to do. Like,
But that's about the same as your other one.
about.
Compare both wrists for me.
And also, just look, I think I actually made this arm skinnier than the other one. Put them up together like that. No, they're still lighter. This is still, let me say this, you can still see the beyond boundness, but now we can actually, you know, see that she has bony structures. Before it was just like one solid.
I think right around here, this is where a lot of the muscles have just shrank
Yep.
in that cast.
But I mean, you're ready. Like, I feel like when you go home, there's no reason, like, you can't just whip out the regular FasciaBlaster and really start going off on your arm now.
Oh yeah.
The key is to do the fascia pulls and to, like, gently get everything open, get the joints open, and then you can really, like, start going bananas.